Clean versus dirty shadowing in a case of uterine perforation. She was a 20-year-old primipara who underwent manual vacuum aspiration twice. The first was 10 days prior to presentation, and the second was 3 days later. She was being managed as a case of septic abortion, and she was on antibiotics. On review, she was stable, asymptomatic, but still bleeding per vagina. So this is a red flag. The examination revealed a non-tender big swelling, which was equivalent to 18 weeks gestation. At surgery, the swelling was found to be thickened bowel and omentum, which actually completely encased the uterus. Now I will replay this video, but the first play will demonstrate the difference between clean and dirty shadowing. Here you can see clean shadowing is high attenuation solids, it is stones, bone calcifications, while dirty shadowing is as a result of gas or air. So you can see that in abscesses, in perforations, or when you have gas forming organisms. Appearance of clean shadowing is anechoic, black, well defined, while dirty shadowing is hazy, contains echoes, and is ill defined. Distal edge, clean shadowing, sharp cutoff. Dirty shadowing, irregular and fuzzy. Example of a clean shadowing is gallstones, renal calculi. Dirty shadowing, bowel gas, abscess. So let's play the video. So here, let's just pay attention to the shadowing. We come back to the other aspects. So here, let's just pay attention to the shadowing. We come back to this later. So you see this clean shadowing here. And look at the characteristics of clean shadowing. So clean shadowing from fetal parts here. So now let's pay attention here and we see dirty shadows. You see that? See this? You see that? Dirty shadow from abscess, perforation, hazy, irregular. So here you can see that this is dirty shadow. Look at it. And look at where the shadow is coming from this abscess. Look at the dirty shadow here. See the dirty shadow here and clean shadow here. So I believe that this is clear how to differentiate between clean shadow and dirty shadow, the cause, the appearance, the age, and examples. So in the replay, we now look at this abscess. As you can see, this is the bladder, this is the vagina. You can see collection in the pouch of Douglas, collection in the uterocervical pouch. You can see this bowel here encasing uterus here. So this is a replay. So here, look at this pouch of Douglas, uterocervical pouch. And look at this collection within the endocervix, the endometrium. Look at the open external os. Yeah. So look at the fetal parts here. And look at the area of perforation posteriorly here. You see that? Area posterior perforation from manual vacuum aspiration. Look at it here. So look at the bowel here encasing the uterus, the fundus of the uterus. Here is abscess, which dirty shadows. Again, look at it. So is this a pelvic abscess? following perforation due to manual vacuum aspiration. So here you can see the still images, clean shadow, clean shadow here. You can see the access here, and also collection in the pouch of the glass. Laparotomy, look at the area of perforation, about 7 centimeters perforation. So in this video, we are able to show how to differentiate clean from dirty shadow, and the dirty shadow in this case is a result of the perforation and also the infection, probably with anaerobic organism. So this can actually explain the dirty shadowing in this case. Thank you very much for listening.